We are live on DSTV channel 421, Go TV channel 144, around the world at myjoyonline.com and on your digital TV because we are free to air. The details now. Residents at CB in the Amponsah North District of the Oti region are on SOS call to government, groups and individuals to come to their aid to help provide potable water. The current dire situation is that the residents would have to dig around a stinky, dirty brown stagnant water and wait for it to gather for collection. Such is done in turns until all get water. The only hope for the community is a dugout constructed by their forefathers in the 1960s, but it's currently under siege by herds of cattle in the area as the animals also struggle for water to survive. The situation, residents say, has affected every aspect of their lives. They say government workers posted to the area leave after short stay. Peter Senu visited the community and has more in the following report.
Residents at Sibi in the Amponsah North District tell JoyNews the animals would not want to drink from this source. From these dugouts, it is first come, first serve until one's pans are filled with water. The brown, stinking, dirty, stagnant water is what residents here depend on for their immediate domestic use.
Since we vacated last 3 months, we have no water to drink. We find it difficult to go to Damango and go to fetch water. So this one we are pleading. Everyone should help us. Look at how our people are suffering. We can since morning to evening, we will not get water to drink. We the student cry. Sometimes we doesn't have the zeal to go to school because some of the leaders in our communities, they are there. Yes. They can't even talk for us that we don't have water. And we have so many great people in this society, but we see nothing. So if you people can help us, I should help us. Look at this water, very dirty. We are going to drink, cook. So we are pleading so that you guys should help us.
Those who can afford say they would have to travel to Kwaza or Damango to get safe drinking water. They spend not less than 50 Ghana cedis a day. The mostly peasant farming residents say this is affecting their quality of life. The dire situation has affected education, health, and even religious activities in the area as Muslims enter the holy month of Ramadan.
As there is no water, the way we do our things, if it has come to dry season, we cannot go to farm. And the market too, and ladies are not suffering. So some don't have time for their work. We have reached Ramadan now, and there is no water in the mosque. So we travel far away to get water. And then fasting too, we have to wake up early and do our cooking. So it has become a problem.
Most children also turn the place into playground as they wait for their turn. 2 children, we are told, died from snake bites while searching for water. Residents are placing SOS call to all and sundry to come to their aid immediately to provide potable water as their plight is dehumanizing.
To the best of my knowledge, digging boreholes here will not get water. If only government will help and give it a big dam, that one will even help more than even coming to dig. Even if it is 1,000 boreholes, we will not get water. Because people are trying a lot of digging it, but they are not getting water.
If a day break like this, how the children to get the water and bath and go to school is a major problem in our community here. And the doctors, those are here, nurses, they are suffering of the water. If they post them to come here and do works excellently because of the water, they will not come. So now we need the help from the government to assist us.
This dugout has been dug since in 1960s, our great-grandfather's time. And I will plead on the government if you can come to our aid to convince it to a dam, so that maybe one village, one dam, if you can convince it to it, so that it can stay. When they dug this thing, it takes us 20 years before it is even getting full. And they re-dig it again, it takes 15 years, and this is where it has been reached. So I'm pleading the government to come to our aid. If the one district, one dam, or the one village, one dam, if you can come and then reconvent it, so that it can be deep for us to use again.
The 2 chiefs who preside over the town have this to say.
So come no ye din ma ye wa ha papa nsu a ye nye wa ha no gise kpasa na ye beko nkola kwa
ne haye pa tuturu ne se ebia motokin anase car na sesewo se yetinye na dabi mistake bi ba mo na se accident ba danu de na ya wie kura.
Naturally, Sibi Hilltop, it is difficult for us to get water. A lot of politicians have been trying to help us in order to get water for us, but when they dig, they don't get water unless they travel distance from the village before they could get water. So in fact, the dam that our forefather dug is a place we normally source water from, and it's very dirty too. So it has not been helping us. Every year we suffer for water, not only this year.
Quality health delivery in the area is equally being affected.
And in prevention, you need water. Water is life. Without water, you can't do anything. And how can you live in a community without water? It's a very serious issue. I've been here for 4 years now. And if I want to share my past experience, it's not easy. Because I'm not disgracing myself though, but sometimes you have to bath once a day because there's no water. It's very serious. Sometimes when you touch a client, water to wash your hand becomes a problem, which is very serious. As I'm talking to you now, in this era of COVID-19, we need water for our clients to wash their hands before we touch them, but there's no water. We are at risk. We have families somewhere. They need us alive. Even Ghana, they need us alive. In this community, they need us alive because we are helping them. Without water, how can we live? We are begging. Any agencies, any organization, the government, they should come to our aid. We are begging them.
And we also have a maternity unit here. So, like when it comes to maternity issues. So as for water there it's a thing that it is most often needed in our health sector. If you are not to get a good drinking water for a very long time, you hardly would you want to stay. So there are some health workers that have been posted to the district, but then within some few time, they take a transfer or they do like whatever thing that they want to do, then they get out of the district.
SDG Goal 6 continues to be a mirage as communities continue to struggle with access to potable drinking water. From Sibi, here in the Nkwanta North District, in the Oti region, my name is Peter Sanu for JoyNews.
Really disturbing situation in that town. Well, with us to discuss the availability and provision of potable water is Henry Amponsah Johnson. He's Regional Director of the Community Water and Sanitation Agency, and Yao Ata Ahin, the WASH Technical Coordinator, World Vision Ghana. Thank you, gentlemen, for making time to be with us this morning. Your initial reaction to the plight of these people in Sibi? Let me start with you, Mr. Yao Ata Ahin.
Hello.
Hello, sir. Can you hear me?
Yes, I can hear you, but I'm quite faint.
All right. I'm asking your initial reaction to the story we just shared from Sibi.
Okay. First of all, let me say good morning to your cherished viewers, and to say that the story is a very sad one, but not very surprising at all. For those of us who work in the communities, this is something that we see on a daily basis. There are several parts of this country where people can simply not have access to safe water. And it is sad that in the 21st century Ghana, children and adults should be traveling long distances only to be able to fetch contaminated water. It is sad, and it shouldn't happen to any country at all. Ghana is far beyond this, and I think that the earlier we sat down, the better for us as a country.
I'll come back to find out for you what will mean sitting up in this regard, but let me take Mr. Amponsah Johnson's reaction to that story.
Hello.
Hello, sir. Thank you for joining the program.
Yeah, thank you very much. Yes, unfortunately, I couldn't hear the sound of the video that was shown, but I was able to look at the picture. Rightly, as Mr. Ahin said, it is a pathetic story for our brothers and sisters in that enclave in the 21st century to be going for such unwholesome work for their daily needs. But for me, coming from community water and sanitation agents, it's not that we haven't done any water project in that enclave. Somewhere in 2008, community water, through the assistance of the Ghana government, the British government, DFID, and then the Danish government, Danida, supported CWSA to construct a water system from Damanko to Pasa, which covered all the civic community. And as at now, and even if your reporter could bear witness, there are concrete tanks, about 9 of them in the various communities spread from Damanko to Pasa. But you see, when CWSA was operating under the facilitating regime, we built water systems, and based on the complexity, we tried to give it to the private sector to operate and manage these facilities on behalf of the district assembly. But unfortunately, when this newly constructed facility, which cost almost over 4 million Ghana cedis, was handed over to this private sector, he rounded them down. And that is the result we are seeing now.
And so was anybody held accountable for that? Because
yes,
if an organization out of its will provides a water system for a community and another organization runs it down, I want to believe that there was somebody, had to answer for that. And was there anything of the sort done?
There was, the structure is such a way that when we facilitate and put the system in place, it is handed over to the district assembly to do the monitoring and supervision role on day-to-day basis. CWSA will only come in to do backstopping. So it is the district assembly's role. And I must say that it is because of these challenges that we have faced over the decades. That is why CWSA has now moved away from the facilitation role to get professionals to do the direct management, and now CWSA will be in charge. As we are speaking now, CWSA, through the government of Ghana, has gone in for a 30 million euro loan to rehabilitate that system. Even today, the transformer that is down, we are installing the transformer today. The contractor is on site to fix the transformer today so that we can get water to Damanko, and then we'll be working on the rest as far as we get to Papa. But the loan that we have gotten is going to cover from Damanko, CB Hilltop, CB Central, up to Pasa. We have a big treatment plant at Damanko. We have the intake, we have lay pipes, but because of the mismanagement. So CWSA just came in some couple of a year ago, a year and a half ago, and we are trying to put all the broken facility back in place. We have gotten water system managers who are there, a water system manager and his staff who are there now trying to fix it. So that is the story now, and I want to assure the listening public that within the next 6 to 1 year time, CB and its environment will be given potable or safe drinking water.
Mr. Amponsah Johnson, and let me just go back to that question about somebody being held responsible for the mismanagement. You mentioned a private organization was given the mandate to manage it. Which private organization is it?
Yes, the name of the private, you see, I left water reading some time ago, but I think it's something resources, under AG, something resources, that that was giving the contract to manage the facility on behalf of the district assembly. A contract was signed, all right?
Okay.
Yes.
And since 2008, what has been done? I mean, you are now telling us that some loan has been secured and we're going to put money back into a system which cost us already. So since 2008, when this organization ran down, this project? Was anybody punished? Was anybody questioned? Was anybody made to pay some money for the mismanagement?
Yeah, sure. They were called to a roundtable conference, and I think all issues were addressed. That is one of the challenges we had. That's why government has mandated CWSA to go in, manage the facility directly, bring in professionals so that it will be accountable to CWSA. And that is what we have started across the country. And I think Joy needs to be aware that we are now in direct management. As we are speaking now, we are working in 200 and gradually most of them are broken down. We are fixing them. And then in the next couple of years, the 1,063 pipe systems that we have across the country would have professionals managing, and will ensure that water will be flowing 24/7.
Let me come to Mr. Atta Ahin, who is with World Vision Ghana. Clearly, this story is one that shows financial loss. We invest and then we don't manage, and we keep investing in systems that have already been invested in. Clearly, this is not a good sign of a country that wants to deal with this water problem in rural and even urban areas.
Well said, and I like the angle from which you are coming from. We know that we pay a lot of lip service in this country, and this is what is killing us. Who in this country doesn't know that no strategy for poverty reduction can ignore people's vital requirement for safe water? Who doesn't know that the easiest way to deny people social and economic opportunities and to trap them in a perpetual cycle of poverty is to deny them access to safe water, safe drinking water? And yet, we know all this, and we allow communities to rely on such dirty and contaminated water. I mean, it is unacceptable anywhere in this world. Look, unfortunately, safe water delivery doesn't appear to be a priority, and very little improvement is happening. Let me tell you that in 2011, the multiple indicator cluster survey revealed that almost 80% of the population has access to safe water. In 2018, the same percentage of 80% has access. So it means that from 2011 to 2018, we have not made any improvement. And that shouldn't be the case. Apart from the fact that we are not investing enough, the inequalities are also just too much. Say that when you live in rural areas, the tendency that you have access to safe water is limited compared to somebody who is living in the urban area. This is something that we have to deal with. But when you ask anybody anywhere, particularly in a rural and small town community, they will prioritize access to safe water over many other developmental, issues. And yet, access to safe water is one of the least prioritized, both at the central government level and also at the local government level. This is something that we need to deal with. Government must begin to realize that water is life. And without water, there's no way this country can develop. And put in place a comprehensive plan, not the ad hoc type that we have been seeing. Look, I will not be surprised that after this story, we'll mobilize and go and fix the situation. So how many times must communities rise up and complain before we go to their aid? When we can have a plan that develops this country, every community, in a consistent manner, without, these ad hoc measures that we put in place. And when I say we should sit up, that is exactly what I mean. Meanwhile, the institutions of state mandated to deliver safe water, like Ghana Water Company, Community Water and Sanitation Agency, have adequate capacity. What they lack is the financing. And that is what I think government should be providing to them. Now we know that donor funding is dwindling because they say we are a lower middle income economy. And so we can take care of ourselves. But the government of Ghana's budgetary allocation to the wash sector is so woefully inadequate that it can barely cater for goods and services and then remuneration.
So Mr. Atahin,
very little for investment and capital expenditure. I think that we need to sit up and begin to invest in the right places, the productive sectors of the economy, which have multiplier effects on other sectors of the economy.
All right,
otherwise, our people will continue to be afflicted with poor health. Our children's education will be in jeopardy. Household income cannot increase, and our people will continue to wallow in poverty. That is not what we want to see.
All right, Mr. Atahin, you gave us some statistics proving your point that we've seen very minimal improvement in providing water to communities like Sibi. In your estimation, if the trend doesn't change, how long do you think it will take us to cover at least 90% of our population in terms of access to potable water?
Sorry, I didn't quite hear the last bit.
I'm asking you, based on what you said earlier about the rate at which we are growing in terms of providing water to rural communities, if the trend continues, how long do you think it will take us to cover at least 90% of our rural population?
Good. Let me tell you that as a country, we have done quite well. Up to a certain stage when we began to relax. When by 2011 we had already overachieved the MDG targets, we thought we had arrived, and therefore we began to relax. If we go at this pace, the 20% that is left to be served, it will take a very, very long time to be able to serve them, because the investments are not coming. The systems are breaking down. And I'm happy that CWSA is taking the right steps to ensure that they bring professionalism into the management, operation and maintenance of the water facilities that we put up. I think that is the way to go, because communities simply don't have the capacity to be able to manage the systems that we entrust into their care. Something else must happen, and that is the professionalism that CWSA is introducing. What we are needing is that this professionalism does not also, sacrifice the quality and also the access to poor and vulnerable communities.
All right, Mr. Amponsah Johnson, in that story, we heard from some residents who suggested that boreholes will not work in their area and that they needed government to provide them with dams that could provide constant water throughout the year. What goes into determining what the best water system is for a community? How do you determine that?
Yeah, before we come up with any feasible water source, we need to conduct a feasibility study. And we have done intensive work between each enclave, that is from Damanko to Pasa, and we realized that the groundwater feasibility there is just inadequate. So drilling boreholes is not an option. Secondly, dam construction is also not an option because of the inadequate rainfall, that means the one seasonal rainfall in that area. And moreover, when you do a dam, you will not be doing any good services to the community, because these are farmers and cattle rearers. And these animals definitely will take advantage of these dams and they will pollute it. So it is not the option. Because when we are talking about safe drinking water, we will not go in for dams, because if we want to use that resources in building satellite dams for these communities, it will be too much expensive. So that also is not an option. Grow so good, the River Oti is passing through Damanko. That is why we were able to take advantage of the River Oti, which we were able to tap into. So to serve that enclave, we have to only improve, as Ahin said, we have to improve based on resources. And thank God we've been able to get some resources which we are soon going to use towards them. Improve on the water situation. So boreholes is not an option, and secondly, the dam construction also is not an option for safe drinking water.
Okay.
Yes, dam construction can be for irrigation and then maybe for livestock, but not for domestic use as drinking water.
So what kind of system was put in place in 2008, as you mentioned?
We have the infrastructure. It's a conventional water treatment tank. We have the intake where we have pumps. Okay. Water is lifted from the river and then treated through by first giving because of the turbidity of the water, it is inoculated with alum. It passes through a coagulation system where the plugs are removed. That is, the turbidity is through a sedimentation process and it goes through a filtration system where then it runs into a clear water well. Clear water well, it is disinfected with a chlorine at its optimum dosage. And then we have high lift pump that lifts the water into these 9 elevated tanks before distributed to the individual community. So that is what we are working on now, and we hope that in the near few months, CB and its enclave might have this challenge softened while we put in the long-term measures by rehabilitating the entire system so that we can even extend to other communities that are surrounding the city and its Damanko-Kwasa enclave.
So it's been about 12 years since this system was installed. What is the state now?
Oh, in terms of the concrete structure, it's perfect. We don't have any problem with the concrete structure. The only challenge we have is with the mechanical component. That is the pumps at the intake and then the clear water well. And then some of the pipes over this period might have to be other, their capacity have to be increased or must be changed because there have been some few damages here and there. Some due to the community themselves using tractor to plow and then they will just destroy the pipe. So these are some of the things. So we would be able to fix it. Luckily, OT region has been established. I've just been sent here. And as we are speaking now, I'm even categorically trying to address their water challenges here. So that is it. So the infrastructure itself, we must say that by 10% it is very sound.
Okay, we'll be wrapping up this conversation shortly, but I just can't help but ask why we've sat for almost a decade, over a decade actually, before trying to fix this system which you so elaborately described.
It has not been a decade. I said the system was completed in 2008, handed over to a management firm to manage it for a period of 10 years. So we would say that from that time to about 2018 thereabout, 2017 thereabout, they were managing it before CWSA through government policy that we should change from the old way of managing system facilitation.
Sorry to cut in. So are you saying that at that time, the residents of CB were accessing potable water through that system?
They were accessing potable water. The infrastructure is there as evidence. They were accessing potable water.
Okay. Well, thank you for that bit of clarity because it was just bothering my mind. Okay, so let me come to you, Yao Ata Ahin. As we wrap up this conversation, you work with an organization that's been providing water to communities across the country. And you've already shared with us that you think that providing water to rural communities is not a priority. In your dealings with government, have you been able to figure out why?
I think that government has not appreciated the enormous importance of access to safe water enough. I think that government is treating this sector as business as usual, like any other sector, forgetting that this is a sector that drives growth in all other sectors. Look, without access to safe water, there's no way industry can survive. There's no way commerce can grow. There's no way education can thrive. There's no way healthcare can improve. And there's no way any productive sector can make any gains. And therefore, we need to pay particular attention to access to safe water. That is what we have not been able to do. If we have appreciated it enough, we will prioritize it above almost all other sectors. But apart from that, I think that over the years, we have over-relied on underground water, groundwater sources. And therefore, when we go and we drill and we are unable to hit water, or when we hit and the water is contaminated, we cap it and we leave. But we need to invest in alternative water supply sources. That is what we have not been able to do. There are several communities with, raw water, surface water. Can't we treat this surface water and pipe it for the communities to use? Like the water I am seeing on your screen, so dirty, so contaminated, and yet we may have some mechanism to be able to treat this water and serve the communities instead of relying on the boreholes. Can we also begin to invest somehow in household water treatment and storage systems, such that even this water that they are fetching, even though contaminated, they can at least purify it through some household treatment and storage mechanisms so that the water becomes wholesome. This is something that we need to do. But I think that above all, government must build the capacity and resource the agencies, Ghana Water Company, Community Water and Sanitation Agency, and the NGOs that we have in this country who have capacity to be able to deliver. Once we are able to support them, I think that safe water delivery will be accelerated, and very soon everybody everywhere may have access to safe water.
I really appreciate your time this morning. Yawata Ahin is a WASH Technical Director with World Vision Ghana, and we also had Amponsah Johnson, who is with the Community Water Sanitation Agency in the OT region, and he's promised that in about a year's time, this problem will no longer be there. We'll be following up keenly on this so that residents of CB can also enjoy some good quality water for themselves. You're watching News Desk with me, Bernice Abubedulansa. We'll be back with more. Do stay. Thank you so much for staying here on News Desk. Now, COVID-19 has had a negative impact on our health system. However, the Christian Health Association of Ghana reports the deadly virus had some benefits after all. At a press briefing highlighting findings of a study conducted by the association, Deputy Executive Director Dr. James Dia explained diarrhea cases have seen a drastic decline in rural health facilities in Ghana, while cases of cholera have so far not been recorded.
The most important finding on this assessment was the issue of diarrhea diseases, which was significantly low starting from March 2020 and has remained low up to now. Now, many of the health staff say that's one of the benefits of the COVID interventions. Hand hygiene has really improved diarrhea diseases. And it is instructive to know that throughout 2020, in all the facilities that we did assessment, there was no reported case of cholera.
On the average, if you take April, for instance, April 2019, the number of diarrhea diseases that were recorded were 2,000. If you take when COVID started in April, that's 1 month after COVID, the number was about 600. So the difference is about 1,400.
Now, the study was conducted in 18 rural and semi-rural health facilities across the country. Dr. Dia says the decline in the cases of diarrhea and cholera is as a result of adherence to COVID-19 protocols.
The campaign on prevention for COVID, i.e. using hand hygiene, mask masking, social distancing, had positive effect on reducing the incidence of infections, including upper respiratory tract infections and diarrhea diseases. Now, because of the large uptake of hand hygiene, if you go to most places, people are using hand sanitizers. People are washing their hands. Because of this, diarrhea diseases went down. In the past, I'm talking about immediate past, before the COVID, one will require that you observe respiratory etiquette. So use your handkerchief when you are coughing, or use tissue paper or use your elbow when you are coughing. In the absence of this, one is required to now wear face mask from March 2021. While these were difficult, especially using handkerchief, tissue paper, or coughing into your elbow, use of face mask offers the needed protection. So, from this finding, we know that hand hygiene, face mask use are intervention that we can use to reduce diarrhea diseases and respiratory tract infections. And I hope that all of us, health delivery agencies, will pick this up and embark on massive campaign even when COVID ends.
Now to some very sad news. 3 lives have been lost in an accident that occurred on the 37 Burma Camp Road at around 10 p.m. last night. The incident, which involved 2 young men alleged to be Ford boys, and eyewitnesses say they were racing on the road and they took the lives of 3 hawkers and badly injured 3 others. Judith Awotritando was at the 37th station early this morning and reports commercial drivers are blaming private drivers for the frequent road accidents there.
Accident it missy. The be wa yana kwanson. That is said in radio see wa hi. Only 2 cars. Omutwa ma traffic na no jo anajo nka 7 to T Junction to Hano. Cars 4. Omnya private cars. Omutwa cars no mo races. Omukọ races. No mo races no. Do Hano. First one do call. The second one went to me. Speed no mo twa. Careful. The car na quarter to say moto. Omo ba ku bi ho e yo be park wo so clinic. Omo ye 4 Sundays, Saturdays, any holidays. Omja home charge bus stop wo. Ujina ho ama hu se ka bia nkwa no matutu. And ya ha kwa ndo omo taye papa. To mesra Ghana police do weekends na. Omo nkote T Junction new so clinic. Sundays, any holidays. No mo taye say no. Na nra omo se traffic no. No, I'm starting by I'm teaching so clinic. Cars 4. But me who say me who no come that me for no church roy. And so who baby amadiato.
Okay, that Patriciana Hamame. So as he's explaining, he is confirming that about 4 cars yesterday were racing on this road, and according to him, this is something that happens regularly on this stretch. He's calling on government to come to their aid and stop these drivers from doing this. So we have another driver here, sir. Patrick, what witness say accidents na see wo ha enwana?
No na ye ni amono. Na so yellow do cry na asam ni si wo yechi. The woman say, young drivers no, private drivers no. Obinu woman driving woman ni mo hwe because of automatic na abaninti no. Obia koto private no drive special Uber for no. Woman ena ha wo kwan so. Asa na ube trotro driver ni bia we nya problem wo kwan so no. Ayedi. Asa na trotro driver be nya problem because trotro driver no we dimate waka no mu our experience when ejuma no mu asana ni master kra o de car ni be man ba private drivers no ube wende okotoka onyeska kaka no okotoka obi onim no wo fi o se o ko kire mi drive oni no ko am no oni ba am no o se we un drive no unam kwasu na we load passengers e be 23 or 40 na uba ube wan na wo mu TS wenim otisi when you na wabo break sometimes baby cry yes or you overtaking one no yeah special yeah am no test service baby a police for ni gina no latin so say na wo mu ba latin so ready cry wo mu fem wo mu yeshu police for ni yeshu ba ye trotro drivers ye fem na police for ni di echi aba station am no ba chichi wo nti police for na wo mu master authority no e ma private for no wo mu yes no.
So as you heard him, he's lamenting about private drivers. He believes that private drivers are the cause of accidents in this country. He's saying that most private drivers just go to the driving school and a few days after they just go on the roads and they are driving. According to him, they don't have enough experience. He's also saying that most commercial drivers usually work as mates for years, and so they gain enough experience, which makes them capable of driving. So there are a group of drivers here as well, which we would be speaking to. Pacho, good morning.
Fine morning.
Pacho, driver Bako Kacha is mates no munya experience pa. Mo drivers or money drivers na ye juma che. Now so private drivers now mo call a driving school pena eja omo esi kwan so wo hwa asa driving school yi
into me the driving school no bo na enye mame. Now I say driving school be called driving school say yen taking more years. Wow. Now driving school no mo kwa 1 month na esi wawe no mo akwa license amani pa no. Now I say truck drivers say any mate for no. Ubanso obikita truck we dimate for so many years. If you bet me dimate be 5 years, 6 years. No dimate. Wow. Intia mate no dinu onim kwanso and onim say na nyame ekono. Into no mate ordino octa 21 passengers. 21 passengers. Into no our experience. The master ni okra or yet me can say on faka no come back or on license no dimate. To more to get experience. Wow.
Na say woka say omo license. Na how omo license saying
still ordinate. Yes.
License no one demand because on court driving.
Wako for license. Be so wa drive ordinate very years. See why we say some for license. Into me for license no. Or for license now. Or sent me dimate. More no or getting more experience. Wow. Into bet me the bear 2 years. So I can. Wow. And sana be our starting on one kasa as akogene car. Into more experience send the private drivers no more kita cars no. You see a private drivers be brave and call driving school crap. Or kotoni car. Oh, buame na chem kakaka na abua no. By a week 2 weeks obenso no ran kasa akogene license no or car. Into no cause the problem is saying truck drivers. The private drivers no cause the most problem ni nyina send truck drivers. Into say ensure ye na the private drivers no ensure na say na ebe ya na ye hu na truck drivers say no problem bi ba say na ya kwatia truck driver. E bia private driver no cause problem no. Na e bia private driver no ni sikanti we say na ya na ya di atia truck driver no.
So another driver here lamenting about private drivers and how they drive on our roads. According to him, we are always blaming truck drivers for causing accidents and rough driving on our roads. But according to him, he's saying that private drivers are mostly to be blamed for this, confirming what the first driver said. Okay, so we are going to another driver. Hello.
Yeah.
English? So, okay. So, what do you think? What should I cause accidents?
One say, Mr. Kaka make a phone say, accident no. More private drivers in young boys in the crowd. Me a coming crown and cabin be being found. Mean to me, women too can't call be answered that. But I mean, so 21 years to be tomatoes are carry. A Juma Benoye. One who when you say scano, no other talk and I said be a minimum be Okunya Niska, and to mean to make a scaffy and as a visa. But on the moment, 2 pounds, yeah, the mate be 2 years, 3 years, and see him driving, or see him driving. This is a total driver being as dental. It be any mistake, it be any break in our pipe. Pass over conquest Americade. Saturday, as I ban you be found. Say, over talk, so she age, I'd better talk. Say, more now, as any passes a welcome. Ni passes a welcome. Sabio about Mamia. I mean, I told idea where we Nancy and baby SS or the better. I ble a tongue a friend me kuniade. It's one my busana dead. Alcolano is a be a bear, my sponsor in South Conano. To make the Kaka make a fine, me near be moved by me and a friend, Miss me a driver. Kaka make a fine, Sabano. On your be far, young boys and this time, West is not what to talk as. He said, Ukres can call lance officer, be or lance sama. And found so when him driving, and found driving test. To no make a car make a ban on your bibin fa, young boys in to count. They say depending on check now, say 21 years, me crash up, Kaya. Edma Benami. So I tell you, is me.
Judith Awachitando interacting with some commercial drivers at a 37 bus terminal. We need to stay safe on our roads. Please do that. That's how we all arrive alive. Well, coming up shortly, George Adder Jr. will be joining me. There's a lot to talk about, especially on his documentary and other sporting activities that happened. Tamala's year of return. Watch this. We'll be right back.